The man sat in the corner of the VA waiting room with a closed tactical knife on the table in front of him, and he didn't say anything at all. He wasn't yelling. He wasn't making demands. He was just there, the way a downed power line is there on a wet road, still and present and carrying a charge that everyone in the room could feel without touching it. The clinic administrator, Annette Burr, was pressed against the reception desk with a phone to her ear. Two veterans, who'd been waiting for their afternoon appointments, had already slipped out the front door. A woman in her 70s, there for a prescription refill, was sitting 12 feet from the man with both hands in her lap and her eyes closed, because she'd come in on a walker and she wasn't going anywhere, and this was apparently how she had decided to handle it. The clinic's security officer, a big quiet man named Russell Hoke, had his radio in his hand and was standing near the exit, watching and not moving, which meant he was doing exactly what Phoebe Carlin had seen him do in small crisis situations before. Holding space, not escalating, buying seconds. Then Phoebe came through the corridor door from the back. She read the room in the time it took her to take 2 steps. The man, the knife on the table, closed, not open, which mattered. His hands flat on his thighs, not reaching. The angle of his shoulders, the quality of his stillness. She had seen this kind of stillness before, in places where the stakes of misreading it were considerably higher than a waiting room in Marlow, Texas. She looked at Russell and shook her head once. He lowered the radio. She didn't pick up a phone. She didn't call for backup. She walked to the far side of the waiting room, pulled a chair away from the wall, not close to the man, not in his direct line but visible, and sat down. "Hey," she said. Her voice was low and carried no performance of calm in it, because performed calm was a different thing from actual calm, and people in crisis could always tell the difference. "I'm Phoebe. I work here." The man looked at her. He was in his late 40s. His hands were shaking. His eyes were red-rimmed and lost in the particular way that had nothing to do with intoxication and everything to do with a kind of internal weather that had been building for longer than anyone in this room could measure. "You're not going to call someone," he said. "I didn't call anyone." A pause. Something in the set of his jaw shifted by a fraction. "They always call someone." "I know," she said. "I'm sorry about that." She didn't move toward him. She didn't press. She talked to him in the same unhurried voice for 11 minutes, and somewhere in that 11 minutes, the shaking in his hands slowed and the weight in his shoulders changed from braced to something different. Something that was the beginning of exhausted rather than the end of controlled. When she stood and said, quietly, that there was a room in the back where he could sit without anyone watching him through a window, he picked up the knife from the table, put it in his pocket, and followed her. He followed her, not because she was an authority figure, and not because she'd talked him into it. He followed her because she had said 4 words, somewhere in those 11 minutes, that people in this particular kind of darkness recognized the way you recognized your hometown's water tower when you'd been away for years. She never told anyone what those 4 words were. Later, Annette Burr would ask. Phoebe would say he needed someone to sit down, so she sat down. If you're already wondering what those 4 words were, you're going to want to stick around. Drop your city in the comments. I want to see how far this one travels. The assignment board at the Marlow VA outpatient clinic read the same thing it read every weekday morning. Carlin, Intake and Case Management, 8 a.m. to 5 p.m., Monday through Friday. Phoebe had been working this assignment for 11 months. She knew the layout the way combat medics know terrain, by corridors and bottlenecks, by which exam room had the stuck door and which hallway flooded in hard rain, and which attending physician moved fast under pressure, and which one paused too long before making a call. She was 32 years old. She'd grown up in western Kansas, enlisted at 21, and spent 5 years in the Army as a medevac crew chief and flight medic before a rotor wash incident in her final year took 30% of the hearing in her left ear and ended her flight clearance. The discharge had been medical and honorable, and she had left without particularly intending to become anything else. She'd become a nurse because it was the only civilian work that matched the pace of what she'd done in the field. She'd chosen the VA because she understood the people it served in ways that were difficult to explain in a job application, but that showed up immediately in practice. She'd chosen Marlowe because it was small and quiet and far enough from everything she'd done that the past had room to stay behind her. The past did not agree with this arrangement, but she was working on it. In 11 months, she had learned to calibrate. She moved a little slower than her instincts recommended. She deferred on diagnoses she'd already made in her own head. She let the attending physicians take point on clinical decisions even when she'd arrived at the answer 2 beats earlier. She did this because she'd learned that the skills she carried made people uncomfortable when they surfaced unexpectedly, and uncomfortable people became institutional problems, and institutional problems had a way of getting very personal very quickly. She had been doing fine, and then the man with the knife had made her stop calibrating. She'd known it would happen eventually. She'd just hoped for another year. The second time the clinic had reason to notice her, it was a Tuesday. A veteran came in for a routine medication review, 43 years old, presenting as agitated, intake notes from the front desk describing him as possibly impaired. The attending on duty had already flagged him for a toxicology screen. Phoebe was restocking an exam room when he passed in the hallway, and she stopped. She watched him for 7 seconds. The slight drag in his left foot, the way his eyes tracked the overhead lighting with a specific quality of irritation that wasn't irritation. She followed him to intake and asked to take a second look at his neurocheck before the talk screen. The attending, Dr. Wanda Kale, had been at the clinic for 16 years and regarded most suggestions from nursing staff with the patience of a river regarding a levee, steady and fully aware that one of them would eventually give. But she had also, over 11 months, come to notice that Phoebe's suggestions rarely required following up. Dr. Kale ordered a head CT. The veteran had a subdural hematoma that had been building since a fall 2 weeks prior. He was transferred to Baylor Medical within the hour and was in surgery by late afternoon. After Dr. Kale found Phoebe at the station. "Walk me through it," she said. Phoebe described what she'd seen in the hallway. The gait, the light sensitivity, the asymmetry in his facial expression that flagged cranial nerve involvement. She gave it the way she'd give a field assessment, sequential, specific, no elaboration beyond what was necessary. Dr. Keel was quiet for a moment. "Where did you learn to read a neuro presentation like that?" she said. "Combat medicine," Phoebe said, which was true and also the most compact version of the answer she was willing to give. Dr. Keel nodded slowly. She looked, in that moment, like a woman who was updating a file she'd been keeping for a while. 2 days later, Annette Burr's assistant left a message on Phoebe's work line, asking her to come to the director's office. Annette Burr had run the Marlowe Clinic for 7 years with the specific efficiency of someone who believed a smooth institution was a protected institution. She was 54, precise in her clothing and her language. And she had a folder on her desk when Phoebe sat down that she kept her hand on but didn't open immediately. "Thank you for coming in," she said. Phoebe waited. "We've appreciated your work here," Annette said. "Your patient satisfaction scores are high. Your incident reports are minimal. Dr. Kale speaks well of your clinical judgment." She opened the folder. "However, there have been questions." Phoebe already knew the shape of what was coming. She had known it was possible from the day she'd walked the man in the waiting room through the corridor and closed the door. Annette went through it methodically, the de-escalation that exceeded any protocol in Phoebe's training record. The neurological catch that had preceded the attending's assessment. 2 staff members who had separately asked how Phoebe seemed to know things before she should know them. "Your nursing license is current," Annette said. "Your credentials have been verified, but your employment history prior to nursing school has gaps that our standard onboarding process didn't surface. If you have prior clinical training or experience that isn't documented in your personnel file, policy requires that it be disclosed." Phoebe looked at the folder. The gaps were real. They were real because the work she'd done during those years could not be fully described in a civilian employment form without a security officer reviewing what she was and wasn't permitted to say. "I'll get you a full supplemental history," she said. Annette held her gaze. "Within 5 business days." "Yes." Phoebe drove home that evening along the flat highway through the middle of Marlow, past the water tower and the grain elevator and the diner with its Wednesday special sign still out from the week before, and she sat at her kitchen table for a long time before she made dinner. She submitted the supplemental history on Thursday morning. 2 tours in Afghanistan attached to MEDEVAC units operating in Kunar and Kandahar provinces. Classified mission support she could describe only in general terms. The flight incident that ended her service. The commendation that had been quietly and specifically not processed for reasons that no 3-sentence civilian explanation could adequately address. She listed the qualifications: the crew chief certification, the emergency surgical assist training acquired in the field. She did not editorialize. She sealed the envelope and left it with the front desk before her shift. By Monday afternoon, she knew it had been read. She knew because Dr. Keel began their conversations at a half step's more distance. She knew because 2 fellow nurses stopped asking her opinions on intake assessments they'd previously flagged her for. She knew because when she passed Annette Burr in the corridor, the director looked at a point roughly 18 inches above Phoebe's left shoulder and kept walking. The clinic was recalibrating around her. Not in the way that happened when someone was celebrated. In the way it happened when something had been discovered, and nobody was certain what to do with what they now knew. She expected a meeting. She expected on some level a particular kind of ending. What she got instead was a phone call on a Friday evening from a number she didn't recognize. The voice on the other end was female, mid-40s, carrying the flat command register of someone whose primary communication mode was briefing rather than conversation. Nurse Carlin, my name is Captain Eloise Rader. I'm calling on behalf of a patient being transported to your facility tonight. He requested Marlowe by name. He has a complex medical history and a service animal that is not a standard companion animal. A pause. There's already been an incident. Phoebe was very still. What kind of incident? Your clinic's security officer attempted to separate the service animal from the patient during intake. The animal prevented that. Nobody was hurt, but the intake bay is effectively inaccessible and the patient cannot be reached for treatment. Another pause. The animal is a Belgian Malinois, former military working dog, operating under medical service protocols. He will not respond to standard handling commands. Phoebe looked at the window. The sky over Marlow was going dark at the edges, the flat horizon still holding the last 20 minutes of orange. What's the patient's name? She said. Sergeant Major Dixon Farnham, U.S. Army retired. The name landed in a specific place inside her chest that had nothing to do with surprise and everything to do with recognition. Dixon Farnham, Medal of Honor, 2009, Kunar Province. She had been on the MEDEVAC bird that pulled him out of a valley outside Asadabad. She had been 24 years old. It had been the longest 43 minutes of her life. She had not known until this moment that he was in Marlow. I'll be there in 9 minutes, she said. She put the phone in her pocket, picked up her keys, and drove. The clinic's intake bay had the specific controlled stillness of a situation that had not yet reached disaster, but understood exactly where disaster was. Russell Hoke stood at the outer doorway with his arms at his sides. A paramedic who had transported Farnham was sitting on a bench outside with the blank expression of someone still processing what he'd seen. Through the half-open bay door, Phoebe could see the exam table. She could see Farnham. Semi-reclined, skin ashen, his breathing audible from the doorway, shallow and working harder than it should. She could see the monitoring leads someone had managed to attach before the situation locked down. She could see Vega. The dog was positioned between the exam table and the room, 90 pounds of Malinois, low to the ground, absolutely immovable. His eyes moved across the space in a slow arc, holding every person in his awareness simultaneously. He wasn't panicking. He wasn't lunging. He was doing exactly what he'd been trained to do in the only language available to him: hold the perimeter until someone authorized to release it arrived. Russell looked at her when she badged through. You know this animal, he said. I know his handler's call sign, she said. That's close enough. She walked to the doorway and stood where Vega could see her. The dog's ears shifted. His head turned toward her with the slow precision of something tracking. She let him look. She kept her hands visible. She kept her posture open. She did not look away from his eyes. Then she said the call sign, not a standard command. The call sign from the valley outside Asadabad, the one that had been on the mission briefing that no one outside that flight crew had ever said aloud. Vega sat down. Not slowly, not reluctantly. He sat the way trained working dogs sit when the right person gives the right signal, completely without remainder. The room was silent. Then Phoebe was already moving, pulling on gloves as she reached the exam table, her eyes on Farnham's face, and then on the monitors, and then on the quality of his breathing, which was wrong in a way that went beyond the transport notes she hadn't had time to read. His presentation is pre-ictal, not agitated, she said to the room. There's a difference. Get Dr. Kale now. I want a full neuro panel. Dr. Keel arrived in 4 minutes. She took one look at Phoebe's face and didn't ask whose call it was. She started ordering. The bay came alive. People moved. Equipment was positioned. The line that nobody had been able to place was placed in 90 seconds. Vega remained seated at the edge of the table, his eyes fixed on Farnham with the unwavering attention of a creature who has learned that holding still is its own form of action. Phoebe worked. She tracked the monitors, anticipated instrument requests, and somewhere in the second hour, she became aware of Russell Hoke in the doorway. Watching her with an expression she recognized from her first week at the clinic, the expression of someone who has just understood something they had long suspected but couldn't name. He took out his phone. He made a call. Annette Burr scheduled a meeting for Monday morning. Phoebe already knew what it would be. Annette had read the supplemental history, and the classified sections had confirmed what 11 months of careful observation had already suggested, that the clinic had a nurse operating significantly outside the scope her personnel file documented, and that the institutional response to this information had already been drafted. The meeting never happened. What happened instead was this. Farnham was stable through Saturday. Sunday night at 11:42 p.m., his body did what his military medical record had always predicted it eventually would, a history of TBI-related autonomic instability that his former surgical team had flagged in a classified addendum that had never transferred to his civilian VA chart, because the operations that caused it had never appeared on any civilian record at all. His blood pressure spiked to 218/140. Phoebe was there because she'd stayed, not because protocol required it, because she had treated this man on a helicopter in the dark over Kunar Province, with 53 fragments of metal in his lower body, and a traumatic brain injury that 2 flight surgeons had told her was not survivable, and she was not going to leave him now to a chart that didn't know his history. The standard drug for hypertensive crisis was nicardipine. Phoebe had read in the classified addendum that her military clearance had once given her access to, and that she had committed to memory the way she committed to memory everything that might matter at the worst possible moment. That Dixon Farnham had suffered a documented adverse reaction to calcium channel blockers during his post-injury recovery. The kind of reaction that, in a hypertensive crisis, made the standard drug not the right drug. She needed labetalol. She was drawing it when Annette Burr walked in. Behind Annette were 2 people Phoebe had never seen, a man and a woman in professional clothing with state agency lanyards, and behind them, barely visible in the corridor, a young woman with a phone held low at her hip. Phoebe registered all of it in a single sweep and kept drawing. Nurse Carlin. Annette's voice had a quality it hadn't carried before, something underneath the administrative precision that was working very hard to hold a shape. The regional office has issued a temporary hold on your clinical authorization pending tonight's review. You need to step back from the patient. The monitor alarmed. Vega, at the corner of the room, made a sound, not a bark, something lower, the kind of sound that had no civilian category. Phoebe looked at Annette. She looked at the 2 agency representatives. She looked at the monitor. "He'll go into hemorrhagic stroke in the next 4 minutes if I don't push this," she said. "The standard drug will accelerate that. I know his history." She held up the labetalol. "This is the correct drug for this patient." Nurse Carlin, I am giving you a direct administrative instruction. I hear you, Phoebe said. She inserted the line, document it however you need to. She pushed the medication, slowly the way it needed to be pushed. She kept her eyes on the waveform and counted, and the room was absolutely silent, except for the monitor and Vega's breathing and the quality of Annette's stillness behind her, which had the texture of a person who is given an instruction and watched it not be followed and doesn't know what comes next. At the 47-second mark, Farnham's pressure began to move. Not immediately, not cleanly. His body had been pushed past its edges, and it moved with the stubbornness that showed. But it moved in the right direction, and Phoebe held the line and watched it, and did not release her attention from the monitor until the second minute confirmed what the first had suggested. She stepped back. He's stable, she said. Get Dr. Keel. She turned around. The young woman in the corridor had not lowered her phone. The video went up at 1:17 a.m. By 8 the next morning, it had 93,000 views. By noon, it had been picked up by 4 national outlets. The headline across all of them was some version of the same sentence. VA nurse pushes medication under state hold to save critically ill patient. Full footage available. Phoebe didn't see it until Russell found her in the medication room at 9 a.m. and turned his phone toward her. Clear audio. Clear visual. Every word she'd said to Annette, every second of the 11 seconds she'd spent preparing the labetalol while an administrator told her to stop, the moment she pushed the medication and the room went quiet, and then the monitor's alarm slowing and steadying, and Dr. Keel arriving to find Farnham stable and a nurse standing calmly at the edge of the room removing her gloves. Who filmed it? She asked. The agency representatives brought a documentation team, Russell said. Turns out the young woman in the hallway had a different idea about what should be documented. Phoebe looked at the view count. It had climbed another 11,000 while they'd been talking. It's not just Texas, Russell said. It's national. She put the phone back in his hand and went to check on Farnham. He was awake, sitting up carefully the way people sit up after a night that had nearly gone the other way. His color was better than it had been in the 14 hours since he'd arrived, and his eyes, when they found her in the doorway, were sharp in the way she remembered them from the helicopter. Eyes that had been badly damaged and were nonetheless, underneath the damage, fully functional and assessing. Vega raised his head when she entered. He watched her cross the room with the same steady attention she'd come to understand was simply how he existed in the world. You know who I am, Farnham said, not a question. Kunar Province, she said, November 2009. I was the crew chief on the MEDEVAC. Something moved across his face, an old thing like a door long bolted, finally shifting on its frame. I told you something, he said slowly. On that helicopter, something I've never said out loud to anyone, before or since. He looked at her carefully. You didn't put it in the report. No. Why not? She pulled a chair to the far side of the room and sat down. Outside the window, Marlowe was going about its Tuesday morning, indifferent to everything that had happened in this building since sundown the day before. Because it wasn't mine to put in a report, she said. It was yours to say when you were ready. He was quiet for a long moment. Vega shifted his weight and settled again. 12 years, Farnham said finally. I've been carrying it for 12 years. I know. And you've been here, in this town, 11 months. He shook his head, slowly, not in disbelief. In the specific way a person shakes their head when the world's arrangement turns out to be stranger than they had given it credit for. The thing I told you on that helicopter, he said, about what happened on the ridge before the extraction. I remember. It's the center of a federal investigation, has been for 2 years. There are people who would prefer I couldn't testify to it, who would prefer that the people responsible for my care didn't understand enough of my history to keep me alive long enough to do it. Phoebe looked at him steadily. The transport tonight, she said, not routine. Not an accident, he met her eyes. Someone in my emergency planning flagged your name specifically when they designated this facility. Someone else found out. They spent 6 weeks trying to find a way to remove you before I arrived. He paused. They were 8 hours too late. The door opened. Deputy Inspector Noah Callister from the DoD Inspector General's office entered without knocking, which was apparently how federal investigators in Marlow conducted themselves. She was 40-something, in civilian clothes that fit her like a recent adaptation, and she set a folder on the nearest surface and looked at Phoebe with the direct, undecorated attention of someone delivering a briefing rather than having a conversation. "You've been told the shape of it?" she said. "Just now." Stuart Mull, the VA's regional legal counsel, was approached 8 weeks ago. He was provided information about your background and offered a consulting arrangement conditional on finding a regulatory mechanism to remove you from active clinical practice at this facility before Sergeant Major Farnham's scheduled evaluation. She was calm about it, the way actuaries are calm about numbers. The state hold filed last night was his mechanism. He filed it without authorization from the regional director or the board, using privileged personnel information he'd obtained in an advisory capacity. "He thought he was managing institutional risk," Phoebe said. "He thought he was. He was an instrument." Callister looked at her folders briefly. "Two are anticipated in the next 36 hours. Mull's bar review has been initiated. The state agency has been informed of the circumstances under which their emergency hold was filed, and it has been suspended pending review." She looked at Phoebe a moment longer than the briefing seemed to require. "For what it's worth," she said, "the people who tried to remove you did not do sufficient research on who they were dealing with." She picked up the folder. "We'll need a formal statement, Nurse Carlin. Thank you for your time." She left. Phoebe sat with it for a moment. Then she looked at Farnham, who was watching her with his sharp, tired eyes. "You should rest," she said. "In a minute." He didn't look away. The commendation from Kunar. It was processed at the unit level and then held. The operational details of that engagement were inconvenient for officers who had made certain decisions that night. Your assessment, as crew chief, as the medic on scene, was accurate and went into the record, and someone buried it rather than let it stand as confirmation of what actually occurred. She already knew this. She had known it for 9 years. "I've been trying for 2 years," he said, "to say true things about things that actually happened. I'm tired of losing that argument." He looked at her with the full weight of it. "I'm not going to let what was done to your record stay done." She looked at the window. The Marlow morning was bright and flat, and asking nothing of anyone. "Get some rest, Sergeant Major," she said. "Then we'll talk about it." Something that was close to a smile moved across his face, the particular expression of a man who has heard the officer's version of "not today" and knows exactly what it means. He closed his eyes. Vega rested his head gently against Farnham's hand. Phoebe stayed for another minute in the quiet room before she went back to work. The board convened without Mull. Annette Burr sat at the far end of the conference table, with her hands flat on the surface in front of her, her folder closed, her expression carrying the weight of a person who has spent the intervening hours revising a position she had constructed carefully over a long period of time. Dr. Keel sat to Phoebe's left. She had not asked permission to be in the meeting. She was simply there. The regional director's representative confirmed the hold was suspended. Mull's referral was being formally withdrawn by the institution. Phoebe's clinical authorization was reinstated with a notation that it had never been legitimately suspended. Then Annette said, without looking at the wall or her folder or any neutral point in the room, "I want to say something." Everyone waited. "I built a case," she said. "I used the gaps in your record to build a case that you were a problem. I believed the narrative I was constructing." She stopped. She was not performing this. She was a woman saying something difficult in plain language because the honest version of it was the only one she could still stand behind. "I was wrong about what those gaps meant. I looked at everything you were and decided it was a liability." A pause. "It wasn't a liability. It was the reason a man is alive on this floor right now." Phoebe looked at her. "I know," she said. She left it there. It was enough. 3 weeks later, an envelope arrived through official channels. Inside was her service record as amended. The classified addendum from Kunar Province restored to its correct tier and cross-referenced with the commendation that had been held 9 years ago at the unit level. The operational details as they had actually occurred. Her assessment on record, confirmed, accurate, no longer buried. And in the notes field, in handwriting that wasn't official language and that she didn't recognize. She stayed with him until the secondary bird came. Everybody on that ridge came home. The record should have always said so. She didn't know if it was Farnham who had written it. She thought it might have been. She put the document in the drawer of her desk at home. Not buried, not hidden, just placed where it belonged. And then she made coffee, finished it while it was still hot, and drove to Marlow. The Veteran Neurological Care Unit was approved 5 weeks later. It was not a smooth 5 weeks. Budget negotiations, credentialing reviews, a territorial argument about physical space that took 2 weeks to resolve. But it moved, the way things move, when enough people have decided that the alternative is worse than the change. Russell Hoke transferred to the unit's patient support coordination team. He showed up on the first morning with his thermos and his usual economy of expression and stood in the hallway looking at the new signage with something that wasn't quite a smile but occupied the territory next to one. "What do you think?" Phoebe asked. "I think this should have existed before you got here," he said. "Maybe." "No maybe about it." He unscrewed his thermos, "but it's here now." The first patient they received was a 58-year-old woman. A former Army logistics sergeant referred from a clinic in Abilene because her care team couldn't account for the constellation of symptoms she'd been presenting for 4 years. Nobody had asked about the IED event in her final deployment. Nobody had connected her disrupted sleep, her specific pattern of word-finding difficulty, her sensitivity to ambient noise, to the blast exposure she had sustained in 2011. Phoebe asked about it in the first 20 minutes. The answer changed everything about the management plan. She thought about what Farnham had told her on the morning of his discharge, standing in the clinic's small lobby with Vega at his side, and the West Texas morning coming through the glass doors, flat and hot, and asking nothing of anyone. These people don't need a different system because they're complicated. They need someone who understands what made them this way. That's not the same thing. She had the understanding. She'd had it for 9 years. She'd spent 11 months practicing it at half volume, within boxes that had never quite been built for her shape. She was done with half volume. She was done apologizing for what she was made of. In the morning, she went to her first patient's room, sat in the chair beside the bed, and said, "Tell me what you've been dealing with. All of it. Take as long as you need." The woman started talking. Phoebe listened, not waiting for the relevant detail, not managing toward a diagnosis, but actually present in the way that 9 years of standing in difficult places had taught her to be present. Without performance, without the gap between what she felt and what she showed. That was always where it started, not with the investigation or the viral video or the reinstated credentials or the commendation finally put to paper where it belonged. It started here, in a room, with a person who was carrying something heavy and another person who understood the weight of it and wasn't afraid to stay. That had always been the job, and Phoebe Carlin, 11 months removed from everything she'd been, done running from it, was finally doing it as her whole self. Her whole self, it turned out, was exactly enough.